Chamberlain, and I am joined here with Susan Pease Banitt. And today we're going to be talking about COVID and trauma, because that's what's going on in the world right now.
Yeah, that is what's going on in the world right now. I thought when I was thinking about what are the next videos I want to do, we are, as of today, today's filming, we're right in the middle of the COVID surge here in Oregon, but also everywhere around the world. And it's been really intense. And a lot of us are feeling it either personally, or some of us who are very energetically and empathically sensitive, we're feeling it in the collective. And there's a lot of talk about that in circles of people that I am talking to. And it's a good time to talk about it because we're all suffering a lot. And I think sometimes we don't even know how much we're all suffering because we've kind of habituated to it.
Yeah, so it's like when you're going out shopping or when you're going out and trying to see friends, you know, there's a lot of social anxiety with all of that and how to properly socialize again. And also a thing with, like, if you see something, like if you're out there and you see people without masks, like it's kind of like triggering to some people.
Yeah, it is. Like, there's so many ways that COVID creeps into our consciousness and stresses us that we don't even really, I think about it consciously. Like, I was noticing my daughter and I were watching movies together, and whenever there's a scene where a bunch of people are crowded into a bar or something and they don't have masks on because it's pre-COVID, we get a little reaction, and then we have to go like, oh yeah, this is pre-COVID times, right? So right now we have these built-in responses into our nervous system that is creating just sort of constant background noise of stress and anxiety about COVID. And it varies on whether, it doesn't matter if you're liberal, conservative, you know, from the north, from the south, it kind of doesn't matter. We're all having the background noise. Hello there, baby. We're all having the background noise of COVID as a stress and as a trauma viewed through the lens of our own experience. And that is personal, it's collective, and it's global. So yes.
And it adds up.
Yes, it's cumulative. Yes, we were talking about this earlier. Brooke and I were talking about this, how you know, there's big T traumas, there's PTSD, so like you're in a car accident or your loved one gets put on a respirator, that's a big T, that can be a big T trauma. A lot of the medical personnel are going through very serious trauma right now and PTSD. And there's also this cumulative trauma, I would say, that is sort of piling up in our nervous systems. In Chinese medicine, trauma is viewed as a digestive disorder. In other words, that when we have an experience that's too big for us to digest and metabolize in our body mind all at once, then it's interesting because body mind combined can be bind, and it makes me think that it binds up, like it binds us up. Mm-hmm. It gets stuck inside of us and we don't know what to do with it. And often what ends up happening is this bubbling up of anxiety that just starts to continually happen inside of us. So because we've never been through this before, we've never been through a pandemic of this kind of global reach with the communication systems that we have in place. So it's not like the pandemic of last century, because there was no internet, and they didn't really, there were newsreels, you know, there were newsreels you had to go to a theater to watch, like, but this constant onslaught of information about what's happening in hospitals all over the world, in countries all over the world, like we're super plugged into each other in ways that were unimaginable 100 years ago. And I think that's adding to our stress, but also it's adding to our solutions, because we have this open sourcing of vaccine information that's unprecedented. So there's some good sides to it, but in terms of the stress that just opening your phone and looking at Facebook or Twitter, you can't avoid it. It's just everywhere right now, and it's in our face. But humans being adaptable, our nervous systems try to adapt to that. So I wanted to talk about what I call the anxiety basement. So everybody's got their base level of anxiety. And if you think of like one of those like needles, it's like green, yellow, red. Ideally, we'd mostly be in the green. And if we get an extra stress, we pop into the yellow warning zone, but we're okay. We're like, when the needle's in the yellow zone, you're like, I'm stressed. I need to do something to reduce my stress. And then you go do that thing, whatever that is. And then your needle eventually drops down to the green again. But when people are under chronic stress, which is something I write about, have written about for patients with complex trauma who come into life with a much higher anxiety needle than the low green needle. So I talk about wanting to work that needle back down to begin with, because if you start in the yellow zone, you're always in the yellow zone. Then what happens when you have an added stressor is you go to the red zone, you go to the danger zone. And that's what I feel like I'm seeing a lot. We're all seeing it. It's showing up in driving patterns. People are getting road rage a lot easier right now. And I think that's been a common observation. It's because people's base level of anxiety is just higher. And not only anxiety, but also frustration and anger. And then if there's a stress on the road, it pops up into an area where they start acting out on the road. And we've all seen that.
Yeah, we're really talking also right now about now is how people are going to be developing and might already have developed like PTSD from this experience, especially having a loved one in the hospital or themselves or even being a medical worker.
Yes. So, of course, just because we lose a loved one or a loved one gets sick doesn't automatically mean that we get post-traumatic stress disorder, but it is a huge stress. There are factors, though, that have to do with helplessness and horror that create post-traumatic stress disorder. And I think we're seeing a lot more of those factors with COVID than we see with other more predictable and expectable kinds of illness and disease processes. So yes, I think there's a lot of people who have watched their loved one dies in very sad ways. For example, not being able to be in the room with them, not being able to provide comfort or receive comfort from them as they're leaving has been very traumatic for a lot of people. It's also traumatic for the medical staff because they want to give people great care and hopefully make them get better, but they also want to give them great end-of-life care if that's what's happening. And as a medical social worker myself, I worked in oncology for a while, I can tell you that it's very painful for medical staff to not be able to engage in their normal ways of managing stress and trauma with their patients and themselves as well. Add on top of that this kind of mixed public feeling towards medical professionals. So some people are very, very supportive of them. Some people are very, very critical of them or feel like they're making things up. And this is painful for them, very painful. And they're not used to it either. They're used to being in a position where people listen to what they say. And now there's a lot of people questioning what they say. Plus they're under more stress, sort of personally and emotionally, from their own stress of not being able to actually do the job they came in to do, which was to save lives and make people's end of life easier. So we've got sort of a gathering storm happening around our medical community that I think a lot of us have been reading about. But from a point of view of mental health, I would say we're having a secondary pandemic. We've got the pandemic of COVID, but there's a secondary pandemic of PTSD that is already, I think the first wave of that is already upon us. And I think there's going to be more waves of it as time goes on, because as these hits keep coming and we can't get our anxiety needle back down, the hits are going to keep popping us up into the danger zone. And it's worth talking about, and I don't want people to just feel hopeless watching this video. There are things we can do about this, and I will be talking about this in this series. So this is going to be a series of videos about PTSD and COVID that we're making. And we're starting with the problem, outlining the problem and the kind of reality of it, to acknowledge it, And then in later videos, we'll move more into solution around it.
Oh, great. Is there anything that you would like to add last here while we wrap up this
Section? I would just like to acknowledge that the levels of trauma, so usually when somebody has a trauma, like a big car accident or something like that, it's personal and intense, and it ripples into the immediate family, but usually it stops right there. If there's something like a fire in a building, the ripples are a little bit bigger. If there's something like a tsunami, the ripples are bigger, but they're still confined to a local area. What's really, really profoundly different in this overview of looking at COVID and trauma and PTSD is that it's absolutely global and pervasive. It spares no one, it spares no country. It's a great leveler, if you will. Like, it's exposing a lot of things that were hidden, that are problems in society and around the world, which also can be a good thing. We're going to talk about the benefits of COVID, and I personally believe COVID's a great gift to the world in a certain kind of way.
Benefit of COVID?
Yeah, benefit of COVID. It's not, when people are suffering so much, it's hard to see that there might be benefits to this, but COVID is exposing a lot of problems that have already been present, but somewhat hidden from majority public view for a long time. But we'll get to that. For now, I just want to acknowledge that if we are walking around feeling stressed, and we all are, there's really good reasons for that, because it might be personal or not to you. You may or may not know somebody with COVID. If you do, of course, it's going to be a lot more stressful and immediate in that kind of way of being a caretaker or somebody who's lost somebody. But even if you don't have that personal experience, we're all having this collective experience, and there's literally nowhere to go to get away from it. Maybe the moon or something, but even there, how are they going to bring supplies back and forth, right? We have this thing where we can't really escape it. We can't go on vacation away from it. We can't go out to dinner and get relief. We can't go to a movie and get relief. We can sit in our bedroom streaming a video. Thank God for streaming videos, right? I mean, we didn't have that 100 years ago. So again, there are some upsides for this period of time for this to be happening in, but it's very, very stressful. And that stress for some people is going to subside and get integrated fairly quickly. But for a lot of people, it's going to continue to escalate, or it's going to trigger off other traumas that haven't been resolved in their lives. And there's just a lot of suffering going around right now with it.
Okay, well, great. I think that's going to wrap up this segment for today. So what would you like to tell your viewers?
Thanks, Brooke. Yes, please, if you get benefit out of these videos, please like and subscribe so that this information can reach other people who might want to know more about post-traumatic stress disorder and COVID. Thanks, and be well.